Hello, Kauai. This is your County of Kauai briefing for Monday, August 30th. Cases of COVID-19 continue to increase with active community spread. On Saturday, we reported Kauai's sixth fatality from COVID-19. The fatality was a male Kauai resident in his 50s who was hospitalized. We offer our sincere condolences to the family, friends, and loved ones of this individual. We're urging everyone to come together, shift our behavior, and work together to prevent more pain in our community. This month alone, our island has had 4 fatalities from COVID 19. Our first 16 months of the pandemic, we had a total of 2. Many more people are now hospitalized, and unfortunately, that means we may see more fatalities in the weeks to come. We have a number of active clusters: 2 social gatherings, 2 places of worship, 1 shelter, 1 correctional facility, 1 educational facility, and 1 occupational cluster in a construction industrial company. The high daily case counts are now exceeding the Kauai District Health Office's capacity for case investigation and contact tracing, despite bringing on new staff daily. If you test positive, they may not be able to contact you right away. Please isolate yourself at home immediately and notify your close contacts. We would like to take this opportunity to thank our entire Kauai District Health Office team for their tireless efforts to protect our community by controlling the spread of disease on our island. It can be a difficult and at times thankless job, but please know that your efforts have made an enormous difference and are greatly appreciated by the majority of our community. Recently, a handful of people have been rude or verbally abusive to their staff. When they call to inform them that they are a close contact of a case and that they must isolate to avoid infecting our community, most people are thankful for the information, but a small percentage of people respond by swearing, calling them names, and refusing to cooperate. Remember, folks, these are members of our community and they are only trying to make sure that everybody is safe, especially people that are sick with COVID-19 or maybe a close contact. There's a number of reasons why they'll call: to check on their health, to check on their status, but most importantly, to make sure that anybody that they may have been a close contact with is safe and healthy as well. They are just doing their job. If the DOH contact tracers call you, help them out. They're not being niele, they're not being nosy, they don't judge. They're just trying to make sure that you and your neighbors are safe. They're working to save lives. They deserve our respect. Governor Ige clarified yesterday that there are no immediate plans for a shutdown. Now is our opportunity to take action to prevent a shutdown from happening. To stem this surge of disease, it's 6 simple things. We must avoid travel unless necessary, avoid gatherings in large groups, and if you have to gather, gather outside. Wear your masks, stay home if you're sick, and get tested and get vaccinated. There is no guarantee that these actions will be enough, but they are our best hope to avoid a shutdown. For an update on our active cases, here is Lauren Guess from the Kauai District Health Office.
Thank you, Mayor. Today we are reporting 19 new cases of COVID-19, including 1 visitor and 18 residents. 2 of today's cases are children. 2 of the cases are related to mainland travel, and the remaining 17 are considered community-acquired. 8 of the community-acquired infections are close contacts of previously announced cases or are tied to one of our active clusters. The total number of active cases is now 294, with 5 hospitalized. Active cases are directed to isolate, and close contacts are being identified, offered testing, and directed to quarantine. Investigations are ongoing. Over the past week alone, we confirmed 263 new cases. This is the weekly highest total on Kauai since the beginning of the pandemic. We have confirmed a total of 1,380 cumulative cases since March 2020. That means that nearly 20% of our total cases over the entire pandemic came within the last week. And 2/3 of our total deaths came within the last month. We need everyone's help to slow the spread of this deadly disease. Please cooperate with our contact tracers. At the very least, please be respectful. Our staff are only doing their jobs and are working very hard to protect this community. If you are eligible, please get vaccinated to protect our children and other vulnerable residents. Please stay home if you are sick and take advantage of our free testing programs. Many of our recent cases are in Kauai residents who traveled, and in some cases infected others after they came home. We recommend avoiding travel at this time, and if you do travel, please get vaccinated first and get tested 3 to 5 days after you return home. We need to work together to get this under control. Mahalo.
Thank you, Lauren. If you do travel, if you come into contact with someone who tests positive, or if you have any symptoms, please get tested. Free drive-through testing is available at the Lihue Pharmacy 7 days a week from 9 a.m. to 5 p.m. For an appointment, visit preventcovidhi.com. Our free mobile testing van is in Keikaha on Wednesday, Kilauea on Thursday, Kalaheo on Friday, Hanalei on Saturday, and at the Brian J. Baptiste Sports Complex in Kapa'a on Sunday, open from 9 a.m. to 1 p.m. each day. No appointments needed. The convention hall offers free testing weekdays from 8 a.m. to 3:30 p.m. No appointments needed. If you are experiencing symptoms, please avoid the convention hall site and get tested at one of the drive-through options. Tests are also available by calling your doctor's office at Wilcox, KVMH, Long's Kapa'a, and Clinical Labs. Visit kauai.gov/COVID test for more info. Now it's time for Ask Dr. B with Kauai District Health Officer Dr. Janet Behrman. Dr. Behrman, the first question is, where can people go to get tested to know if it's specifically the Delta variant? I read that it's a really expensive test.
Thank you, Mayor. I certainly understand that people would be curious to know this information. Unfortunately, there's no testing for Delta that's available as a clinical test. Your doctor can't order it. Determining which variant it is requires genomic testing. The Department of Health conducts surveillance testing for Delta on a sample of positive cases to understand what percentage of the cases in our community are the result of Delta and follow disease patterns in the population.
Thanks, Dr. B. The next question is, will the county ever say how many people they tested each day, then show those numbers of positive and negative results? There just seems to be so many people testing positive with little or no symptoms right now.
The Department of Health makes this data available on its website, and it is updated daily. In the past week, over 4,700 people were tested on Kauai, and 5.2% of them tested positive. Visit the URL on your screen, click on Testing, and then choose Kauai County to see our daily numbers.
Thanks, Dr. B. Here's the last question. Should I wait to get vaccinated because I'm worried about possible long-term side effects?
Most of us have taken vaccines from the time we were babies. That's why we don't have polio, measles, tetanus, whooping cough, and so many other diseases that affected past generations of people. Adverse side effects from vaccines are extremely rare. When they do happen, it's almost always within the first 2 weeks and certainly within the first 2 months. In over 2 centuries since vaccines were created, side effects related to those vaccines appeared within 6 weeks of vaccination. The first COVID-19 vaccines were administered last December. Since then, about 4.8 billion people around the world have received at least one dose of a COVID-19 vaccine. If there were serious side effects, everyone would already know about it.
Thanks, Dr. B. Send us your questions on our County of Kauai Facebook page, and Dr. B will answer more next week. Most of the people sick from COVID-19 have one thing in common: they did not get vaccinated. Community leaders are coming together to urge everyone to take this simple step to protect themselves and our community. Vaccines are safe. Hundreds of millions of people in countries around the world have safely received the vaccines. 80% of eligible Kauai residents have now gotten at least their first dose. Mahalo to all of you. But when you include children under 12 who are not yet eligible, the first dose percentage drops to 68%. That underlines the issue here. We need to do this to protect our keiki and allow them to remain in school. You can get vaccinated today for free. The Pfizer vaccine is available to everyone aged 12 and older at Wilcox, De Lihui Longs, and Lihui Safeway, and Ho'olalahui. The vaccine van, operated by Wilcox Health and Hawaii Pacific Health, will be in Kapa'a on Thursday, Hanapepe on Friday, and Hanalei on Saturday, open from noon to 3 each day. Ho'olalahui pop-up clinics will be open this Saturday at the Kaumakani Community Hall and the Anaina Ho Farmers Market from 9 to 11 a.m. No appointments needed. The pop-up clinic and hospital van are open to everyone 12 and older. The Moderna and Johnson & Johnson vaccines are also available for adults at pharmacies and clinics around the island. For a full list of locations, visit kauai.gov/vaccine. Finally, today, let's go over the 6 top steps we can take to keep our community from getting sick and try to avoid a shutdown. Don't travel unless absolutely necessary. We heard the governor. Now is not the time to travel. If you must travel, get vaccinated first and take a free post-travel test 3 to 5 days after arrival. Don't gather. Please consider postponing your wedding, your baby luau, or birthday party. Let's hold off on gathering until it's safer to do so. But if you are going to gather, stay outdoors. Do know when to wear a mask. Masks work when we wear them. Wear your mask when around others, even if they're not doing the same. My mask protects you and me. Do stay home when you are sick. This will keep disease outside of our schools, churches, and workplaces. Get vaccinated if you can. The data is clear. A vast majority of the people who are being hospitalized are unvaccinated. We can reduce our hospitalizations and have a better chance of beating COVID-19 by getting vaccinated. Mahalo for helping to keep Kauai safe.